Are you tired of not knowing what's happening inside your body? Have you been experiencing severe dryness in your mouth and eyes, leaving you worried about a possible autoimmune disease? If you have been following my channel, you know I've discussed Sjogren disease and multiple aspects of this disease before. But today, I'm going to dive deeper into a less known aspect called neuro-Sjogren, where this condition affects your brain, your spine, and your nerves. In this video, I will discuss the signs and symptoms of neuro-Sjogren, and I will explain to you the basis of the current treatments and what we have available today. So this video is your guide to understand and deal with neuro-Sjogren. Let's begin.
Rheumatologist OnCall.com.
First, let me explain to you what the nervous system is. Our nervous system is a complex network that plays a crucial role in transmitting signals throughout our body, allowing us to move, to think, and to feel. It can be divided into two main parts: the central nervous system, or the CNS, and the peripheral nervous system, or PNS. Central nervous system includes the brain and the spinal cord. The brain is the control center of your body, responsible for processing information from your senses, controlling movement, and regulating all the body functions. The spinal cord is a long, thin bundle of nerves that extends from the brain down to your back, and its role is to be the pathway for all the nerve signals traveling to and from the brain. The peripheral nervous system includes all the nerves outside of the brain and the spinal cord. The peripheral nervous system connects with the central nervous system and to the rest of the body, including your muscles, organs, and skin. The peripheral nervous system is further divided into the somatic nervous system, which controls the voluntary movements and your senses, and the autonomic nervous system, which regulates the involuntary functions like the heart rate, the digestion, the breathing. Sjogren syndrome, or Sjogren disease, as I have explained before, is a complex autoimmune disease that can affect multiple organs, including the brain, the spine, the peripheral nerves, and that includes the somatic and autonomic nervous system. So when I mention it is complex, let me show you how complex this disease can be and how many symptoms can give you. When Sjogren affects the brain, patients can have multiple signs depending on how the brain is affected, as this disease can affect only a part of the brain, or the involvement can be diffuse, affecting the whole brain. Patients can experience symptoms such as headaches, poor memory, poor concentration, brain fog, meningoencephalitis. The meninges is the protective layer around the brain or spine, or inflammation of the brain, which we call encephalitis. It can present as a tumor-like lesion, and it also can affect the optic nerves, causing optic neuritis, which can cause eye pain and vision loss. Some patients have no symptoms, but they can still have changes as we are seeing them on MRIs. There is a specific pattern of these lesions, and many times this can be quite confusing because they can look like the lesions that we see in people with multiple sclerosis, for example. When patients have involvement of the spinal cord, the inflammation of the spinal cord is called transverse myelitis. What is specific for Sjogren syndrome is that most of the time the cervical spine is affected and not the thoracic spine, like in other forms of transverse myelitis. A special form of transverse myelitis is called neuromyelitis optica, or neuromyelitis optica spectrum disorder, when both the optic nerves and the spinal cord are affected by inflammation. Symptoms of neuromyelitis optica can vary, but most of the time will include optic neuritis, which is inflammation of the optic nerve leading to vision loss, or changes, and transverse myelitis, which is an inflammation of the spinal cord leading to weakness, numbness, and sometimes paralysis of the limbs. There are other neurological symptoms such as limb weakness, loss of bladder or bowel control, and pain. But this type of disease is often associated with the presence of specific types of antibodies called aquaporin 4, which can help distinguish it from other similar conditions. And it is very important that this disease is recognized and treated early. What is interesting to know is that sometimes all these neurological symptoms and signs affecting the brain and the spine can actually happen years before dryness of the eyes or mouth. And that's why it may be very confusing to your doctor to correlate these symptoms with Sjogren disease. Now, let's discuss what is happening when Sjogren's disease affects your peripheral nervous system. Sjogren disease can affect multiple types of nerves, from cranial nerves to nerves that will send the sensation to your brain, and nerves that will regulate different functions like the heart rate, the breathing, or even the digestion. Now let's start the discussion with the cranial nerves' involvement in Sjogren's disease. We have 12 cranial nerves that come directly from the brain, and they are responsible for various functions, from your sensory perception, but also for motor control of the head and neck. The most common cranial nerve affected is the trigeminal nerve, also known as the fifth cranial nerve, that is responsible for your sensation in the face, and it's involved in biting or chewing. And this will cause severe pain in the face, usually on one side. Now, when peripheral nerves are affected, patient can experience other symptoms. For example, if a large nerve is affected, like nerves that control vibration, touch, in addition to your movement, then all these functions will be affected. You might not feel well, you might not feel well vibration, you might not be able to orient yourself, and you may also experience some weakness. The test that is essential in detecting changes is called EMG, or electromyography, and that can detect changes in the electrical transmission in these nerves. Now this is a warning because these are more complicated cases of Sjogren's disease, and they need immediate treatment. When just the small nerves in the periphery are affected, we call this small fiber neuropathy, and the main symptoms are related to pain and changes in temperature. Most of the time you may have tingling, numbness in the lower extremities, but you can also feel burning, shock-like sensation, pricky sensation, or an exaggerated feeling of pain to something that is not usually painful. In time, this type of neuropathy can expand and can involve other parts of the body. Now, unfortunately, EMG is not helpful here, and only a skin biopsy might be helpful to diagnose small fiber neuropathy. Another neurological complication is when multiple nerves are affected at the same time in the same area, and we call this mononeuritis multiplex. It can start in one foot with some tingling and numbness and can rapidly evolve to your inability to control the motor function, which can result in tripping and falling. Now, this can also be an emergency, and in many cases there is a severe vasculitis process happening that is associated with Sjogren's disease. So rapid diagnosis and rapid intervention is necessary. I will talk now about the autonomic neurosystem involvement in Sjogren's disease. As I mentioned in the beginning of the video, the autonomic nervous system regulates involuntary functions like your heart rate, your digestion, or your breathing. And many of my patients will complain of symptoms related to their digestion, like abdominal pain, diarrhea, constipation, alternation of those two, sometimes orthostatic hypotension, and even syncopal episodes when they try to change position from sitting to standing. Some patients, they have tachycardia or racing of the heart. They lack of sweating, and they can have urinary bladder dysfunction. These symptoms are so hard to tolerate for many patients and also are very hard to treat, as most of the time we need to have an individualized approach. Let's transition now to the basis of the treatment for neuro-Sjogren. I have a few other videos where I explain in depth the treatment of Sjogren's disease based on the type of symptoms, from dryness of the eyes, mouth, the lung disease, but also neurological symptoms. Let me tell you that the treatment of Sjogren's disease is still under research, and as of today, we treat many of the symptoms rather than the cause of this disease. When we deal with neurological symptoms that are severe, like inflammation of the brain or severe inflammation of the spine, we use powerful immunosuppressive medications like high doses of prednisone or methylprednisolone. Sometimes we use cyclophosphamide or rituximab, and sometimes even we use plasmapheresis, which is a complicated way to remove the antibodies that are floating in your blood through a technique that will filter your blood. When we deal with involvement of the big nerves or autonomic nervous system, we base our treatment on the severity of the disease, and we might also use immunosuppressive drugs or even IVIG. IVIG stands for intravenous immunoglobulin, and this is a treatment made from donated blood plasma that contains healthy antibodies. And IVIG is supposed to block the harmful antibodies when it's given to patients. Now, I will talk more about this type of therapy in my next video, so watch out. When we deal with small fiber neuropathy, we mostly use medications that will decrease the pain, like duloxetine, pregabalin, or gabapentin, just to name a few options. I know this is a lot of information, but it is best to take your information from reliable sources and find a specialist that understands the disease and treats it appropriately. If you want to learn more about Sjogren's disease, watch this video where I will explain all the signs and symptoms of Sjogren and understand your symptoms. I hope this video will help you. Until the next time, stay curious and get informed. Thank you.
Rheumatologist OnCall.com